The healthcare debate yesterday on CNN was interesting, but the proposal appears to be dead. So I'm not really feeling the need to go through the debate point by point. But the long and short of it was a debate between Senators Graham and Cassidy, who are the proposers, the sponsors of the Trump Care 3.0 bill. They were trying to defend their bill, despite the reality that it would be a horrific bill. And they were debating Senators Bernie Sanders and Amy Klobuchar. And Sanders and Klobuchar were there to explain why Graham Cassidy would be bad. It also provided an opportunity for Bernie Sanders to talk about his Medicare for All 2017 bill. And lots of what was said by the Republicans, like I predicted, used weasel language, and it's just the normal stuff that we expected and are used to. One example of that is Senator Cassidy at one point, when asked about pre-existing conditions coverage, he said, "We think our bill has the same pre-existing conditions protections as Obamacare." So the use of the word "we think" as opposed to the bill has the same pre-existing conditions coverage as Obamacare. That is weasel language, okay? But there was one specific thing that Senator Cassidy kept bringing up. He mentioned it. It must have been 5, 6, or 7 times during the CNN healthcare debate yesterday. Sounded like a broken record, and I want to explore it because it's either true or it's not. And the talking point from Cassidy was that there's someone somewhere in his home state of Louisiana paying close to $40,000 a year for health care. Okay, he said it during the debate. He's tweeted about it. Here he is telling the story on Fox News. He talks about this all the time.
There's a fellow back home with a special needs child. He's paying over $40,000 a year, over $40,000 a year for his premiums, has to have insurance, has a special needs child, and it's estimated his premium goes up 20% this next year. That does not take care of a striver, does not take care of somebody whose child has a pre-existing condition. Our bill gives the state the opportunity to do something that does.
Okay. Is that true? I mean, is it even possible to have premiums of $40,000 a year under Obamacare? This is a great opportunity to fact check things, right? Good thing to do. Let's analyze what we're being told. So first of all, is Cassidy talking about $40,000 in premiums or $40,000 in total costs for healthcare? We don't know. We don't know. $40,000 for total costs for a family of 4 is sadly possible, but that's because of the system we have more broadly. Getting rid of Obamacare wouldn't actually change that, and Graham Cassidy wouldn't improve that at all. So let's assume the story is $40,000 a year for health insurance premiums, $40,000 a year. What do we know? Cassidy has told us that this is a man and his special needs child, that they live back home in Louisiana, so that's insurance in Louisiana. And presumably, this is a guy who has a high enough income not to get subsidies, although, again, we don't really know what Cassidy's talking about. So the assertions are $40K a year, and the premiums are set to go up 20%. We don't know where in Louisiana he lives, so you can run numbers on healthcare.gov for someone living in Orleans Parish. That's where New Orleans is. Presumably, it's the most expensive part of the state. The most expensive policy that Charles Gaba on his website, acasignups.net, was able to find, assuming that the family is just the dad and the special needs kid, the dad is 40, the kid is 10 years old, is the Blue Cross Blue Shield Blue Max plan, which is a gold PPO plan, $1,172 per month, $5,400 deductible, $14,300 limit out of pocket. That's the one that's been on the screen that we've been showing you. That's $14,000 for the year, not $40,000, $14,000. What if we come up with a way to make it even more expensive, right? Rerun the sign up, imagining that the family is the dad, a spouse, the 10-year-old special needs kid, and another 8-year-old kid. Now, the most expensive possible plan is $2,345 a month. Well, now we're at $28,000 for the year. We're closer, but still Cassidy is talking about 40 grand. What if we make all 4 family members older and make one of them a smoker? Well, that gets us to $2,752 a month, all right? That's $33,000 per year, still not the $40,000 that Cassidy is talking about. Well, what if they have 3 kids? $3,142 per month, $37,000, but still not there. And here's the kicker. If you have a family of 5, you would get a subsidy for a household income up to $116,000 per year. We don't know what this guy makes. But even if he made $100,000 a year, he would get a subsidy, which would make the plan actually cheaper. There are almost no scenarios where the $40,000 would happen. ACAsignups.net was able to find one, and that was if you had a 48-year-old parent who's a smoker, another 48-year-old parent, 3 kids, and a household income of over $116,000 a year. That would get you to $3,403 per month. That's 40 grand, but that is an incredibly rare and specific case. And by the way, smoking is optional. So what about being the party of personal responsibility? But I actually believe that the 40 grand is a distraction, because the real question is, whether it exists or not, what will we do about it? And would Graham Cassidy fix it? And it wouldn't. In fact, it would eliminate the subsidies of Obamacare. It would replace them with smaller amounts of money through block grants. And none of it actually makes sense. So it's a major distraction. And it also ignores that regardless of income, depending on the condition of this 10-year-old special needs kid, that they might qualify for Medicaid regardless of income. So it is so dishonest to present this without any more information, because it is almost impossible that this is actually real. You can actually make a change, though, to the current system. If the $40,000 example really exists, you can make a change to it. In the short run, you can beef up and raise the eligibility cap for those Obamacare tax credits to include people earning more than 4 times the federal poverty line. That is a specific change you could make now if Democrats and Republicans said, hey, we have Obamacare, even though we disagree about what we should eventually have, here are specific tweaks to Obamacare that we can make. But instead, we've got 40 grand assertions from Cassidy with no actual explanation as to who that family is or why they're paying so much. Send me your thoughts. I'm on Twitter at @DPakman. The show is on Twitter at David Pakman Show. New sponsor today for the David Pakman Show. Today's episode made possible by Blue Sky Binary. Forex trading is a huge space. Millions of traders around the world. 80% of those traders lose money in Forex. And usually it's some combination of lacking the appropriate knowledge, maybe relying on others like traders or auto trading platforms instead of themselves, getting emotional, taking big risks, maybe not following proper money management rules. And Blue Sky Binary offers their education course, and they are a leading financial education and tech company specifically focused on Forex. They've got senior traders with actual trading experience, and they offer a really well-structured and self-paced course in Forex to help with all of the above. The course includes video on demand, online tests, one-to-one sessions, and access to their community of traders to exchange knowledge and experience. And our viewers and listeners can get a 1-week free trial at blueskybinary.com/David. Not only does it include access to their training platform, but also you get a session with a senior trader to go over the basics of Forex trading. Afterwards, it is $99.99 a month. If you want to continue, you can stop and resume at any point. Check it out, blueskybinary.com/DAVID.